Keep in mind that the overall health of Oklahomans ranks 46th in the nation, and that means the demand for ICU beds goes far beyond those battling the coronavirus. There are stroke and heart attack victims and patients facing a myriad of other serious ailments that require intensive care as well. ONR's Jason Doyle reports on a healthcare system under increasing stress.
There is no doubt that the increasing number of people testing positive for COVID-19 is creating a surge on hospital capacity in Oklahoma.
We've seen a significant increase in hospitalizations over the last 14 days. About 40% of these hospitalizations are in the ICU. That doesn't necessarily mean they're that sick they need it, but because hospitals may be segregating patients into the ICU.
We do have increasing numbers. We know that. We've had increased cases. We've had increased hospitalizations. But overall, we're doing fairly well with all that right now.
The numbers show if you contract COVID-19 in Oklahoma, you have a little over a 2% chance of dying from the disease, about the same as the national average.
In comparison to the rest of the country, surprisingly, we're sitting about in the middle as far as mortality, et cetera, goes with that, which is good because we don't necessarily have the most healthy population in the state.
Oklahoma's high rate of chronic disease makes COVID-19 more dangerous to our population. With that in mind, the Oklahoma State Department of Health and Hospital Systems in Oklahoma City and Tulsa have revised the state's COVID hospital surge plan to add more beds if needed.
We've continued to work closely with our state hospital partners and the Oklahoma Hospital Association as they manage their capacity, recently updating our plan and adding 340 additional beds, that are available in addition to the hospital's normal capacity.
Prior to this week's announcement of the state's revised hospital surge plan, Oklahoma City area hospitals were already discussing what to do next.
There are a number of hospitals in the metro that have gotten together over the recent weeks to come up with what a surge plan might look like. Everybody has agreed to increase their beds above and beyond a certain number, and there are different methods with which I suspect each hospital is accomplishing that.
The OU Medical Center is a key component in the state's COVID-19 response plan.
And that we have those units specially staffed with staff who's well prepared to care for this COVID patient population.
Cammie Monarch is OU's chief nursing officer. She's seeing a determined focus among the nurses on the front lines of COVID treatment.
They have this "we're in this together" mindset that I see circulating day in, day out, and so that's really encouraging to me.
Now that a new surge plan is in place, Oklahoma's hospital systems are confident going forward.
The word is collaborative. This has truly been a collaborative effort between all parties involved. We have a very good plan in place, and of course, we hope to never have to activate that plan, but should we have to activate it, it's a very good plan. We have current capacity to meet our current medical and surgical needs, as well as those COVID needs.
That wasn't the case 4 months ago. Quote Wizard performed a study on hospital and healthcare capacity as the pandemic began to take hold in the United States in March.
So what we did is we analyzed Kaiser Family Foundation data, which looked at the number of hospital beds and the number of physicians per 1,000 people in each state. And we did find Oklahoma to be 17th on that list, meaning it's one of the more least prepared when it comes to hospital beds and physicians per person.
Taking a look at newer data from June and July, Oklahoma has improved its capacity to handle the pandemic.
Given its previous preparedness for hospitals, as well as the spike in new cases, we're actually seeing Oklahoma doing fairly well when it comes to hospital bed capacity for COVID-19 patients.
Despite the increasing number of positive cases, the hospitalization rate compared to the number of positives has stayed fairly steady.
Which tells me that we're doing a better job of treating these patients. We know more than we did back then, and we're just doing better jobs.
We have not reached 100% capacity where we could not handle patients within the hospital system. But we have seen, the numbers rise a significant amount in the last few weeks.
The latest color-coded COVID risk map shows that the virus extends beyond the major metropolitan areas. Rural hospitals are seeing an increase in COVID patients too.
When we've had flare-ups in places like Altus or Bartlesville, in McCurtain County, we have been able to manage those patients. If it gets beyond their ability, then they can send it to a hospital within that region that has an ICU and ventilator capacity, or that could send to another metro area.
Healthcare leaders agree that the public must also do its part by wearing masks, social distancing, and washing hands.
And I think if we as a public would just think about that, be smart about it, we really could make a big impact on the spread of the virus.
Jason Doyle, the Oklahoma News Report.